So let's pretend you're sick of popping in those contact lenses every day, or maybe taking them out and cleaning them when all you want to do is just fall asleep at night. Have you ever considered LASIK surgery? LASIK is one of the most successful eye surgeries, and according to the American Academy of Ophthalmology, more than 700,000 LASIK procedures are performed each year. Dr. John Dishler has numerous achievements in his field of refractive surgery. As seen in Forbes magazine for a second year in a row, Dr. Dishler was voted one of America's top 10 vision correction specialists in a nationwide survey of eye surgeons. Dr. Dishler is here today with Joyce Sorensen, a flight attendant who had LASIK just about 6 weeks ago to correct her farsightedness. That's pretty hard to say, like many people do after 40. And Joyce noticed that she had problems when she was reading and writing. Nice to see you.
Nice seeing you.
Thanks.
So, Dr. Dishler, LASIK surgery is frequently performed on younger people, but over 40, are you seeing that more common?
Yeah, you know, half of our patients are baby boomers over 40, and there's a lot of good reasons for those people to consider LASIK. People like Joyce here who, you know, have trouble both with faraway vision, and then at that age, you know, start having trouble with near vision, and there's some things we can do to make both a lot better for them.
So I was told you had monovision. Mm-hmm. So explain that. What is that?
Well, I had my left eye was 2200, and my right was 2200 and my left was 2100. So virtually reading was impossible. So, you know, just having two different sight.
Fighting and trying to balance it out, right?
Giving me a headache, you know, constantly.
So why did you decide to pick Dr. Dishler? What made you finally decide to go with LASIK?
Well, I have seen Dr. Dishler on TV. I read about him in the magazine. His accomplishment, his credentials, extensive and very impressive. So I went and had initial consultation, and I really felt that this was the right place and right doctor, and I was right.
Nice warm environment. You feel relaxed and secure. 303-793-3000 or Dishler.com. Now, doctor, you're educating me on a lot of different things here today. Presbyopia. Did I say that right? Myopia?
Presbyopia.
Okay.
Yeah, presbyopia. So everybody, you know, a lot of people need glasses or contacts to see far away. Younger people can usually see up close without any glasses. But when people hit a different age, but around 40, and for some people a little sooner or later, they can't read very well, and they start needing reading glasses. But what a lot of people don't realize is a lot of people like Joyce here, they're actually basically farsighted, and they hit that age where all of a sudden you probably thought your vision was great when you were young, and then their arms get longer, and the next thing they know, they can't see anything. They can't see far, they can't see near. And for those people, which actually represents probably about a third of the people out there, they really suddenly need glasses for everything. And so fixing their distance vision with a little bit of this monovision or blended vision we can talk about, suddenly they're able to function and do, you know, I think Joyce is a flight attendant, and she can do all the things she needs to do and not need glasses anymore. So that's, you know, really a plus.
Monovision LASIK can really help. It's funny, they just showed the clock in your office. And the reason why they did that was because imagine looking up and you can see what time it is without struggling to find your glasses or put your contacts in. That's what it's all about.
Right.
How can you tell which is your dominant eye?
Well, you know, there's lots of ways to tell. The simple way is we tell people to make a little triangle with their hands, and people at home can try this, and then hold their hands up and look at something, and then far away, and then close one eye or the other and switch between your eyes and see which eye you're looking through the little hole with to see far away, and that's your dominant eye.
Right.
The other eye is not your dominant eye. Usually we fix, when we do this monovision, we fix the dominant eye for far and leave the other eye just a little bit for near, and it would seem like that would really be confusing, and for some people it is, but after a while your brain gets used to it and you can see far and near and everything. But, you know, this is part of the art, and this is one of the things I wanted to get across. This is part of the art of LASIK. Isn't just the science and the lasers and all that. It's figuring out what works for people. And so we have a staff that will patiently help people figure this out. Do you want your dominant eye, your non-dominant eye? And we can try contact lenses or glasses first in the office to make sure that this is a solution that will work for people before they permanently take it on with LASIK. And so that's one of the things that that's why we advise people, at least come visit us first. You know, we don't charge for this, and we'll spend the time to help you figure out is this good for you altogether? And if it is, what's the best kind of combination of things that'll make it come out the best?
Educate yourself. It's easy. 303-793-3000. Are your headaches gone, Joyce?
Yes.
Feel better? Yeah.
It's great.
Life is much easier.
Life is good.
So for some people, monovision is not the answer.
It's not the answer for everybody, and that's also important for people to understand. We'll give you the straight scoop. I mean, there are people, for instance, that are very meticulous. They have to have great vision far away, like for pilots on the airlines. Usually we don't do monovision. The people that have to do a lot of close-up work, a lot of far-away work, people that start out with perfect distance vision and just need some help with reading, they're not always good candidates either. It's usually the people that already need some help with glasses or contacts to begin with, and then we can sort of help those people to, if not eliminate them, at least not need glasses except once in a while.
And what kind of special offer do you have for our viewers tuning in today?
Well, we're offering your viewers that we'll give them an extra $300 off our already guaranteed lowest price. And you know, price is things that people always ask about. So we try to set that at ease by saying, we'll match any other laser center's price. You don't have to pay more to come to us. But in addition to that, for your viewers, I think for the first 25 viewers, we'll give them an additional discount there.
And do your research, just like Joyce did. I mean, go ahead and check out Dr. Dishler. You'll be happy that you did. And you can get that consult, too, and find out if this is right for you. Now, we asked you to come on the show to kind of express why it was so fabulous for you. And what would you say to viewers who are watching today and they're kind of like, should I do it, should I not? What would you encourage them to do?
I would say do it. It just, you know, I don't waste my time looking for my glasses anymore, which is plus for me. And it's just the benefit of seeing things clearly, you know. It's great.
Good, good.
Yeah,
well,
great.
Thank you for sharing your story. You can start the new year with better vision. LASIK is one of the most successful eye surgeries approved for patients 21 years and older and hundreds of patients in most age groups. If you're one of the first 25 callers to schedule an all-custom LASIK surgery procedure at Dishler Laser Institute, you'll save $300 off Dr. John Dishler's lowest guaranteed price. The special Colorado & Company offer is good when you schedule your consultation by January 31st. Your surgery will be completed by February 29th. In addition, when you come in for a free consultation, you'll receive a free gift if you are indeed a LASIK candidate. 24-month, no-interest financing is available. Call 303-793-3000 to schedule your free LASIK consultation or visit Dishler.com. The number 303-793-3000. The Dishler Laser Institute paid for this segment.